All right, I think we're live. It's telling me we are. So welcome. Thank you for joining us today for Mainstream Live. My name is Michael Poppa. I'm the Executive Director for Mainstream Coalition. And for the past 30 years, Mainstream has been engaging and educating Kansas voters on issues that matter to them and directly impact their lives. And so through this COVID pandemic, we are trying to do the same thing, adapting and bringing you relevant information right to your screen. So today I'd like to welcome Tim DeWeese, who is the Director of Johnson County Mental Health. Hi, Tim.
Hey, hi, Michael. How are you? Good, I'm doing well. Thanks.
You're welcome. Great to see you. How are you holding up?
Pretty well. You know, we've been managing, and while we've continued to try to serve our community and those individuals that have major mental illnesses, we're also helping respond to our community as a whole, as a community mental health center, to help people get through this time. And so while about 80% of our employees are working remotely, there's still a small group of us that are coming to the office every day, and because not everybody has access to technology, so we have to be available for those folks. So, but we're getting by and doing well.
Excellent, excellent. What have you found that helps you get through those tough days? Because we all have them, right?
Yeah, I think we all have tough days. I mean, for me, the biggest thing that I tell people is that give yourself permission to have a bad day or two, or even have a bad week. You know, we're all experiencing this for the first time. Nobody's ever lived through anything like it. So, you know, it's a perfect time for us to kind of give one another grace, handle it with kindness and compassion and understanding. And so I think that's the biggest thing that I can tell people is kind of give ourselves a break and give other people a break. Excellent.
Thank you. So what specifically about COVID-19 is it that's impacting people's mental health?
Well, I think that, you know, we focus a lot on our physical health care, and we've talked a lot since this happened about what we can do to keep ourselves physically healthy, you know, washing our hands and maintaining our physical distance. You know, we've called it social distancing. I really try to refer to it as physical distancing because we're social creatures and we have to maintain that social connectedness. And this is one way that we do it, through mediums like this. And so I think it's important that we can try to find ways that we stay socially connected with one another, that we make sure that we don't go through and have socially isolate ourselves.
Gotcha. And I'm sorry if I threw you there for a second. I was getting a lot of feedback on my end, so I had to switch to my headphones.
I had a little bit myself. Okay.
Well, hopefully this helps. But yeah, you're right. People keep throwing around social distancing. That's, you know, I guess a technical term, but it's really about just physically distancing, like you said. And I know that my husband and I have been doing that. We haven't left the house unless we need to. You know, we'll take the dogs for a drive, go on a walk if no one else is out.
And I think that's the perfect thing is we've talked a lot about those things that we can do to take care of ourselves physically, but we haven't really talked about how we can take care of ourselves mentally. And I think there's a couple of things that we can do. We can, first of all, make sure that we maintain some sort of structure. I think I heard a lot of people early on with the stay-at-home orders, they just kind of treated it like an extended vacation. And so, you know, it didn't get up, didn't set a structure, a daily routine. And it's really important for us to set those daily routines, to have structure in our lives. We really do better when we have some structure in our lives. And so I think that's another thing that we can do is make sure that we deal with the unknown by controlling some of the things that we do know. And so if we know we're going to be at home, if we know we're going to have to work from home or do different things, that we structure our days and our weeks so that we don't add additional anxiety onto what anxiety we're already experiencing from the unknown. And I think that's one thing that you can do. I think the other thing that we can do is just find ways to stay socially connected with folks, so that we reach out to our friends, that we reach out to colleagues that we traditionally work with and check on one another. And that you're also making sure that you're taking care of yourself by drinking plenty of water, that you're taking care of your nutritional needs, and that you avoid using drugs and alcohol to kind of cope with some of the anxiety and frustration.
That's great advice. I know for me personally, I've set up my office on our dining room table. And so when I close that laptop at the end of the day, I don't even go back to the table, for the rest of the evening or for one day out of the weekend, just so there's some kind of distance between me and the office. Right.
I think that's really important, is that we set those boundaries. And that's exactly what I mean by structuring our days, because we need to make sure that we still have our time. And sometimes with technology, it can be a situation where we're always connected. And so we do have to unplug. And so I think in a lot of senses, this has created an opportunity for us to find that tech life balance that maybe we weren't looking at before this all happened.
See, I find myself on social media even more now than I was before, because it's one of the ways to stay in touch. But you're right. When I do put that phone away at the end of the night, then there's a sense of relief or a sense of calm, and it really does help.
That's right. I think that's one other thing that can add a lot of anxiety, is if someone is on social media constantly. There's a lot of information out there. Some of it's accurate, some of it's not. And if you're taking all of that in, it's good to stay informed, but you want to make sure that you're getting the best information, the most up-to-date information, and that it's from reliable sources. And so, I think a key is to do exactly what you're doing, and that is to make sure that you also have time where you're unplugged.
Great. And you said, reliable resources. I'm sure we'll talk about this later on too, but what are some of the most reliable resources? Obviously, Johnson County Mental Health, there's state resources. Mainstream has a page for COVID-19 resources at mainstreamcoalition.org. If you had to pick like a top two for Kansas.
Yeah, for me, I think going directly to the source in regards to the state, and then also getting your information directly from the CDC. A lot of the information that we post upon our website is also information that we've collected both from the county as well as then from the state. And then the other pieces are really guidance from the CDC. So those are kind of our top three. I mean, everybody will have their own trusted sources, and I think that's individuals have to decide what the best alternatives are for them. But I think that if you know Mainstream, if they're you all are a trusted organization, and you can get your information from Mainstream, then that's perfect. I'd like for people to know that they can access all of the information regardless of where you are in Kansas. You can look up jocogov.org/mental health, and we have a ton of resources about COVID-19 specific to mental health.
Excellent. Thank you very much. And you just mentioned regardless of where you are in Kansas. So this isn't just a Johnson County problem.
No,
right? Across the state line or county lines, state lines, the world, it traverses the world. What other organizations or county health departments are you working with, and what are you hearing from them?
Right. I think that is the beauty about community mental health centers. Every community across America and in all 105 counties here in Kansas have a community mental health center assigned to work with them. And so they should find out who that community mental health center is, and get information from them. Of course, there are all kinds of private providers that can provide assistance. But we really, as community mental health centers, are those public servants, kind of like the public health department. We are the public health department for mental health, so to speak. So there's one of those in every community. And so if you have access to that information, that's great. But again, you from any computer, you can access the services that we provide, all of the resources that we provide on our website, and they can be available to anyone.
Excellent. What kinds of mental health concerns and conditions are you seeing, and what are you hearing about?
Well, I
during this
think that,
pandemic?
right. I think that you have folks that have underlying mental health conditions, and these kinds of times just kind of work to exacerbate the symptoms that they're experiencing. I think that what we see an increase of is just generalized anxiety, people not sure about what's going to happen, increased depression. When you look at the number of people who've lost their jobs, the number of people that aren't working, all the bills keep coming in, but the funds aren't necessarily coming in. And so where you're going to make your next house payment, where you're going to make your next rent payment, or how you're going to pay this or that, those are all things that concern us. And so in these days, anxiety and levels of frustration are really high. And that's what we're seeing is people who are just afraid and worried about what's going to happen next. And that can take a toll. And just the fact that we don't know what's going to happen. No one's ever kind of been through this process before. That can also add a lot of anxiety. So anxiety and depression are really things that we see an uptick in regards to people calling us for services, or even people walking in for services.
Have you seen an uptick in suicide ideation, attempts, completions?
Yeah, unfortunately, that's something that we're really focused on, and one of the things that we've looked at, we have here in Johnson County seen a small uptick. In the last 4 weeks, we've had 5 deaths by suicide, and those are just the ones that we know of. I would expect that will, as the days go on and the weeks go on, and we look back at some things, we'll see that there unfortunately has been an increase. But that's one reason that we have to stay focused and have these conversations. Make sure that people know that there's help out there, that they can reach out. And this is a perfect opportunity for me to put that out there. We operate a 24-hour crisis line. That number is 913-268-0156. Every community mental health center and every community in Kansas has a 24-hour access line. It may not directly go to that county or to that specific area, but they do have a number. And for ours here in Johnson County, again, it's 913-268-0156. But know to ask for help. And I think that's why we have to be continuing to talk about this. Again, we've talked a lot about what we need to do to take care of our physical health. We just need to make sure that people know that there's things to do to take care of your mental health, and that when you're experiencing trouble, that you ask for help.
Great. And then we'll put that number into the chat as well.
Perfect.
So that people have it. Have there been differences, I guess, between what you're hearing for adults versus youth? Has there been an uptick in some youth activity?
I think it's definitely different. And we've seen a definite increase in both adults and children in regards to the need for services. I think it's important that we have conversations with our kids, depending upon the age of a child and how immersed they have been in social media. They may know more about the virus than we do. But I think it's important for us to have conversations with young people about what's going on, hear their concerns, validate those concerns. And then I think we also have to empower them. And when I say empower, I mean, give them control about or ways that they can control their situation. So making sure that they know that they can do things, like structuring their day, making sure that they know that they can do things to take care of themselves, both physically and mentally. And then I think the other thing that we have to do is we as adults have to provide positive modeling. We need to be able to respond in a positive way. If we're freaked out about things, then the kids around us and the young people around us are going to be freaked out about things. So it's also important that we as adults demonstrate that leadership, but that we also demonstrate positive behavior in how to deal with this crisis. I think the other thing is that we have to understand that if a youngster comes to us and say they're depressed because they're not able to go to school, or, we have a number of seniors that aren't going to be graduating the same way. We have a number of proms that have been canceled. Those are significant events in young people's lives, and we can't discount them. So we really need to listen to what they're saying and validate their concerns and understand that while they may not be experiencing it from an adult's perspective, they are experiencing it from their perspective, and that can be pretty traumatic for them.
Definitely. I'm heartened to see, at least, according to social media, so much support for the seniors this year, so much support for youth that, having birthdays. You see the birthday card parades going by houses. So it's really great to see that the community is responding in a very, I would think, healthy way to this situation, and still trying to engage and model, like you were saying, model some leadership for those kids.
Right. It's been amazing. One of the things that we did over the last 18 months to 2 years is our 0 Reasons Why campaign, which is 0 reasons why there should be youth suicide. And that campaign has really been led by young people. And one of the things that I've come to realize through that campaign is that the young people today in our high schools, the seniors that are graduating, they're resilient, smart folks. And they really have some unique ideas about how the world should be and how to respond to things. I recently became aware of a young lady who started a podcast called In the Young Minds of the Quarantined. And teen was TEENED. And so if you get a chance to look on your favorite podcast platform, you can look that up. But that is from her perspective, what it's like to be a teen in this quarantine time.
And so, sure, youth, teens, younger may not be able to express what they're going through exactly. So it might be a benefit to parents to take a look at this or take a listen to this.
Absolutely.
And could you repeat the name of the podcast? I think we were cutting out a little bit.
Yeah, no, absolutely. There's 2 podcasts that I think really are important. The first one is a podcast that we do here at the Mental Health Center. It's called It's Okay If You're Not Okay with COVID-19. That's the first podcast. And then the podcast from the young person is called In the Minds of the Quarantined. And it's a play on the word, and it's focused on teens sharing their experience during this time.
Got it. Thank you. And then we'll put those in the chat as well, at least the names of them. So what we've talked a little bit about, some coping strategies as far as boundaries and, structure to days. Are there any other coping strategies that people can use right now that are experiencing symptoms, maybe on a more acute basis?
Do you mean symptoms from a mental health standpoint?
Yeah, from a mental health standpoint.
Right.
So maybe I'm having an incident, or I'm having, some sort of reaction to what's going on. I'm right here. I'm in the moment. Right. How do I get out of that moment? Or what can I do?
I think that, when we talk about structure and planning, one of the things that we do with people is we do a lot of crisis planning. And what I mean by crisis planning is that we come up with a plan so that when we start to experience symptoms, we have an idea. Because a lot of times when we begin to become depressed, or we're experiencing really high anxiety, we're not necessarily thinking as clearly as we normally do. And so if you can jot down those things that are helpful for you, maybe jot down some of those resources that might be helpful to you as well. So then when you're experiencing some acute depression, or you're experiencing some higher anxieties, you can refer back to that list. You can refer back to that plan, and it can help kind of guide you to where you need to be. I think that is also where we have to look out for one another. I talked earlier about us, being socially distanced. And really, while it's imperative that we be physically distanced from one another, we really need to stay socially connected. And we have to take responsibility not only for ourselves, but I think it's important for us to check on other people. And just to make sure that folks are doing okay. I think it's also important that when we start to talk about people that maybe are experiencing increased depression or anxiety, that we have a direct conversation with them and ask them, are they having a difficult time? Are they thinking of killing themselves? Being very direct about the questions that you ask, just so that you can find out who it is that's having problems, and then be able to direct them to the right place, the right system of care that can provide the support for them.
So if I were to ask someone, are you, and I've heard you don't ask, are you thinking of hurting yourself? You'd be very direct. You're very direct. You say, are you thinking of killing yourself? Do you have a plan to kill yourself? What next? So they say yes. Best place to call. National
and I think,
Suicide Hotline.
I think the best thing to do is to say, well, let's plan on calling the hotline together, or here's a number that you can call. And again, I know that we're broadcasting this across the state, but even if that's the number that you call, we can get you connected with the services that are in your community. So don't hesitate, 913-268-0156, and we'll answer the phone, and we'll get people connected to the services that they need. The other option is that if they're really concerned about someone, there's no reason not to contact 911 and ask for law enforcement officers to check on someone. And I know people don't like that, but I'd much rather us be safe with individuals than sorry. And so I think it's really important. And I think that's why we have to ask that specific question. If you have a good enough relationship to ask a very personal question like that, and sometimes you don't have relationships with people and you still have to ask that question. What I have found is that people are going to be honest with you, and that they're going to express. If you ask them directly about what they're experiencing, and you provide a listening ear, and you provide some empathy and compassion, that can go a long way to helping someone out of that position. And so I think that, again, earlier I mentioned that we need to listen to young people, and we need to validate what they're experiencing. I think that's not just true for young people. I think it's for anyone that we may be concerned about. We need to listen to them, care about what they're saying, express some empathy, and then help them get connected to the supports that they need.
Thank you. So you touched on it earlier, but are there any other specific ways that mental health providers, such as the county health department or the center, adjusting their service or response?
Yeah, I think there are quite a few different ways that we've had to adjust, and I think that one of the things that we see is that we're having to do much more televideo interactions. We're having to do a lot of telephone outreach, and so while currently we may not be able to see people face to face, and I know that not everybody has technology, so we still do have the availability to walk in. We typically ask people to call before they just walk in, but even if you just walk in, that's totally fine. The thing is that we know that that there's a multitude of different ways that we can get help to people, whether that's through televideo, phone, or even text. One of the things that we also have started to do is we put out a weekly newsletter that you can sign up for. We call it the Mental Health Moment, and it's just a couple of things to kind of help you think about positive things, help you kind of refocus, and then also provide resources. And again, you can sign up for that email on our website. And again, that's available to everyone. But I think that those are the kinds of things that I think are really important for all of us to think about and try to do.
Right. And what was the website again? We'll just keep plugging it.
Johnson, yeah, JoCoGov.org/mental health.
Great. Thank you.
You're welcome.
So are there any other resources out there for people at this time, maybe not directly through the County Mental Health Center?
Yeah, I think, again, I think that you can definitely look at your local public health department. You can also look at Mainstream. I know you all have some resources. But you can also go directly to the CDC and get a lot of information in regards to that. There are also a number of mental health support groups. NAMI, for example, the National Alliance for mental illness. They are a good resource when it comes to support as well. So, all of those support systems that have been in place, they're all still there. We just may have to access them differently. And so I would encourage people to reach out and find those opportunities for them.
And as I understand it, NAMI is not just for those who may be experiencing some kind of mental health incident. It's also a resource for supporters.
Absolutely. It's for family, individuals. It's for people that have lived experience from mental health, but it's also for individuals who support their loved ones who have a mental illness. So it's not only support for individuals, but their family members and their caregivers.
Great. So I do have a question that came in from one of our members.
Okay.
And they said there's a new Overland Park mental health task force. Question is, what role should it play and how can it help Johnson County mental health?
Well, fortunately, that task force, I'm really excited about that task force that's been convened. I was asked to be on that task force and appointed to that task force by the mayor of Overland Park. And so I'm excited about that opportunity. I think that there will be a specific role for the mental health center. And I think that one of the things that we as members of that task force, we're just now getting started in looking at what will the role of each participant be and really what will be the goals. Because I think that may have shifted a little bit with the COVID-19 pandemic hitting right as we started this. And so we'll begin to look at that, but it's a great question. And I'm really happy that the city of Overland Park included the mental health center in the group.
Excellent. Well, we're glad that you're there too. Anything else? Any other words of wisdom that you can give our viewers, our members, people across the state?
I think one of the things that I know other people have heard me say before, and I think this is a perfect and I've often said that that civility was all but absent in our culture right now, and that I think I even said that it should be put on the endangered species list at one time. But this is a perfect opportunity for us to make a change. It's a perfect opportunity for us to provide grace in one another's lives. It's a perfect opportunity for us to express kindness and caring for one another. A lot of times mental health issues are brought forward with the stigma of mental health. And I often have referred to stigma of mental health issues as a virus, not unlike the COVID-19 virus that we're experiencing. The difference is that we know what the antidote for stigma of mental illness is, and that is understanding, compassion, and I think that we can work really. It's a perfect opportunity for us to find a way to be more civil to one another, cut ourselves some slack, cut others around us some slack, and really begin to work together to get through this. Because again, I've not ever experienced anyone getting over anything, any recovery effort by themselves. It takes all of us to recover. And so there will be a period of recovery for us after this pandemic. And we have to collectively come together and recover from this together. And so I think it's really an opportunity for us to change the course that I unfortunately think we were headed down. And it is a perfect opportunity to make something positive out of something that's been very horrific.
I love what you said. It's the perfect opportunity, the perfect time to extend grace, because we're all going through something right now.
Yep. And nobody's experienced it before.
Right. We've never experienced it before, and we're not all experiencing the same thing.
Nope.
Right?
Yep.
All right. Well, Tim, thank you so much for being on with us today. We really appreciate it.
Hey, I appreciate the opportunity. Thank you very much for inviting me.
Oh, of course, anytime. If there's anything any updates that come up, we'd love to have you back on so
Sounds
we can
good.
get the word out. And if anyone viewing wants to learn more about Johnson County mental health and their efforts, please go to their website. And that was
Mental health.
jocogov.org/mental health.
Yep.
Perfect. And to learn more about Mainstream or becoming a member, you can visit mainstreamcoalition.org. Look forward to seeing you next week for our next Mainstream Live. Thanks.